not going to be in front of it. Oh, it's really not.
Move the mic.
Okay. All right. When do you want to start?
You guys are going to do great.
Thank you.
Hey guys, you all excited? Good. How old? Thanks for coming down. Maybe we'll see something. You never know. Got it. Oh, you again?
I know exactly. My little. That my patients will like everything goes to there's a lot of patients that overlap. That see me but go to the practice. Yeah, I think that's great.
Okay. Hi, everybody. How are you? Thanks for. Can I take my mask off? Michelle, can I take my mask off? Yeah, let's do that. I'm Charlie Schlein, and Senior Vice President for Pediatric Services. Thanks, everybody, for coming. Today's a really exciting day for us and I think for society in general, our country, in terms of this approval for the 12 and up kids for the Pfizer vaccine. A lot of people ask, why is this important? The kids generally don't get sick. The reality is some kids do get sick, first of all, both in terms of direct infection and MISC, a post-infectious inflammatory disease, and we're even though we're now at a very low level, we don't expect that it's going to go away entirely, and we clearly can have outbreaks again in the fall and other parts of the country. Secondarily, we know kids spread it, and clearly adolescents spread COVID. And so for the kids to be vaccinated and have a much, much, much lower chance, if any, of spreading it is really key to, one, obviously stopping this pandemic, trying to achieve herd immunity, getting at least closer to it, and stopping the rate of mutation and stopping the spread generally of the disease. And the idea of families getting back together, I think we saw a lot of that this past weekend on Mother's Day, and families being together for the first time in a long time. And I think with teenagers, having this broadly is going to be a big deal, especially going forward into the summer and everybody getting together more. I think things will just be safer. So we are really excited to get to this point. So with that, Sophie, you going to come on next? Okay. Dr. Sophia Jan is going to come up. She is our Director of General Pediatrics at Cohen Children's Medical Center. And we'll talk about the disease in the kids that you're going to meet in a minute. Thanks.
Good morning, everyone. First of all, thank you to my wonderful patients and their parents who are here today for this historic event. Again, my name is Dr. Sophia Jan. I oversee general pediatrics at Cohen Children's Medical Center. I just wanted to echo what Dr. Schlein said. This vaccine being available for kids that are younger now, for 12 and older, is really historic. And, I want everyone to remember that these vaccines, even amongst children, are nearly 100% effective against hospitalizations and death. 2, this is a way for us feeling more comfortable visiting our grandparents again. Hugging and kissing our grandparents. It's something that we haven't really been able to do comfortably. 3, it's going to allow our kids to go back to school in person more readily. And finally, the vaccine honestly will be required if you're going to go travel and you want to be participating in sort of like events and gatherings. And so it'll make it a lot easier for you to travel. I think for families that are still nervous about the vaccine, most important, talk to your pediatrician. Talk to your trusted health professional. Get all of your questions answered. 2, talk to other families who've decided to get the vaccine and sort of understand what their rationale is. Remember that this vaccine is free. There should be no out-of-pocket charges, and it is now widely available across New York State. You just have to make sure that you are requesting the Pfizer vaccine. And the last thing that I wanted to also let the public know is that the CDC, as well as the American Academy of Pediatrics, said last night that co-administration of needed vaccines of childhood can be done at the same time or within 2 weeks of getting the COVID vaccine. So if you're worried like, oh, my child needs their tetanus vaccine and I also want them to get their COVID vaccine, which one takes priority? Right now, you no longer have to worry about that because the CDC and the American Academy of Pediatrics has said it's safe to give both. All right. And with that, I'm going to introduce the lovely families to my right here. First is Sydney Jordan Glover, and she's joined by her mom, Valentine Francois. Sydney is a 13-year-old. She's in the 8th grade at Our Lady of Perpetual Help. She's an excellent dancer, painter. She gets straight A's, and she's excited about traveling and starting high school in person. And I also know that she's an incredible entrepreneur who is excellent at selling Girl Scout cookies. So anyway, with that, we'll get started. You're in your left arm? Okay, great. I'm just gonna clean your arm, okay?
You don't need help with that?
I would love all the help I can get, right? Great. You get TD today, or? done, all right?
Thank you, Sophie.
Yep. No, you're good. This is the real test, whether or not I can take this Band-Aid off or not. Okay, great. All right.
Thank you.
So the next family is Thomas and Brendan Lowe. Thomas is the gentleman sitting right here, and Brendan is the one sitting on his little brother sitting on the far side, and he's joined by their mom, Linda Lowe. So Thomas is 15. He attends Great Neck South High School. He's a Boy Scout, and now he's an Eagle Scout, and he's excited about meeting up with his friends safely. The other thing that I know about this family is that they are incredible musicians and that their whole family gets together around the holidays and performs as a family. All right, so then we'll start with Thomas. Thomas, you want to put in your left arm? Okay, great. All right, I'm just going to clean. All right. All right, Thomas, I'm going to have you hold me. So I'm going to have you hold that. Thanks. You can put your arm down. It's fine. You can put it down. I'm going to have you hold it down. My assistant.
I don't have gloves on. That's why I came over here to open your Band-Aid.
Oh, well, thank you. All right, are you ready? Yeah. All right, Thomas. 1, 2, 3. All done.
The vaccine card.
All right. Thanks, Thomas. But I think it's good. Okay. Thank you. Thank you.
Great.
Yeah. I'll come stand here. And then, of course, Brendan. Brendan is 13. He attends Great Neck South Middle School. He's an amazing trumpet player, and he's looking forward to playing games and indoor sports with his friends and family. this arm, right? Okay. I'm just cleaning. That's it, okay? All right, are you ready? Okay, 1, 2, 3. You're done. Okay, all done. All over. Yay, congratulations. I just, okay, I'm just gonna put this on. Okay, I just want you to like relax and sit down in the chair for a little bit, okay? Okay.
Good morning. I'm Dr. Joan De Souza. I am the director of the Pediatric Cystic Fibrosis Center here at Cohen Children's Medical Center. We are also a TDC research center for cystic fibrosis in this country. And I have my two wonderful patients who I love dearly. The first is Edis Kakamakovic, and Edis is 15. And Edis came to me from Montenegro, where he had to fly to Italy to receive his CF care. Now he's here. When he first met me, he was very afraid. I was not his favorite person. We have grown to really know each other quite well, and he's been a patient here in the ICU. So this is a very important moment for him and for his parents, because this will allow him to never go back to that ICU if he were ever to get COVID, because that was not a pleasant experience and it was very scary. He also has a dying grandparent back home in Montenegro, and the mother asked me about getting the vaccine, and lo and behold, we have this opportunity. So I'm very excited to have Edis be my first 12 to 15-year-old who's going to receive the vaccine. Okay, so my next patient is Michael bin Paris, and he's here with his parents. Michael has been my patient since birth because we diagnosed him very early on through newborn screening, which is great because we can improve the nutritional outcomes of our patients. Michael is also one of the fortunate individuals in this country who's on the highly effective modulator medications, which those studies have been done here at Cohen Children's Medical Center as part of our research center at the CF Center. And Michael is a very active young man and has been very restricted over the course of this year and this pandemic, really forcing him to really stay indoors, really reducing the amount of activity that he can do, which is really unfortunate because in cystic fibrosis, it is a lung disease. And it's very important for them to get outside, to move around, and to exercise. So one of the things that we hope to accomplish with this is that Michael can go back to being a normal young 13-year-old in his hometown of Nesconset, and so we can keep those lungs nice and healthy so when the next modulator comes out, he'll be able to benefit that, and his lungs will be in the best health ever. So here we go, Michael.
Okay, well, we appreciate you all coming out to Cohen Children's of Northwell Health. Obviously, Dr. Germana, Dr. Jan, myself will be here to clarify or answer any questions. So again, thanks all for coming and covering it. And thanks to all the kids.
I don't want to interfere.
Probably the only thing I have is that shutter.